You're watching WDSU News Channel 6 on your side.
It's an alarming trend. Cases of skin cancer are increasing dramatically, but only in women. So we've activated the On-Call network to get some answers. Dr. Sarah Jackson is a dermatologist with Touro Infirmary. Dr. Jackson, just how dramatic is the increase of skin cancer in women?
The increase in incidence in skin cancer in women is quite dramatic. It is actually double for young women than it was looking at studies from 1984.
What's the possible reason for the increase? Is it vanity? Do women just want to be out in the sun more often?
Well, this particular study did not address the reason for the increase in incidence. However, some other studies recently addressed that there is increased recreational sun exposure in young women, and also there's increased tanning bed use in young women. Out of the people who frequent tanning beds, 71% are young women. So, unfortunately, we do think increased UV exposure has to do with this increased incidence of melanoma.
Well, when you say young women, what age group is most at risk?
Well, the age group, all adults are at risk for melanoma. The age group in women that they address in this study were ages 16 to 29.
And I guess that would be maybe the age group that's utilizing these tanning beds. What about men? Have men seen the same sort of increase?
Men have not seen the same sort of increase. And we don't know why trends are leveling off with men. We hope that it has to do with the public awareness campaigns that were launched in the early 1980s, addressing reducing sun exposure and targeting people to let them know the increased risk of skin cancer with increased sun exposure.
Okay, well, with that in mind, and this may be information that a lot of people have heard before, but what are the best ways that women can protect themselves from skin cancer?
Well, as we all know, the best way to protect yourself from the sun is to avoid the sun. We like to say avoid midday sun exposure, which is from 10 a.m. to 4 p.m. We also recommend that you use sunscreen of an SPF of 15 to 30 and reapply at least every 2 hours. And you should also, when you're doing outdoor activities, try to find a shade structure. And the most important thing to do for skin cancer is also to get screening examinations. You should get an examination yearly if you are a low-risk patient, and you should get an exam 2 to 3 times a year for high-risk patients.
Okay. Dr. Sarah Jackson with Touro Infirmary, thank you for being here.
Thank you.